From Faithful Word Media, this is Healthcare Musings. I'm Dr. Hashem Hasabala. Hey everybody, welcome back to Healthcare Musings. Hashem Hasabala here with you. Okay, so back in August of 2024, there was a study published in the New England Journal of Medicine, August 15th, 2024, that made headlines, and it was about cognitive motor dissociation in patients who have disorders of consciousness. And so I saw it. It made headlines. I didn't get a chance to really look at the study in much detail. And then what kind of piqued my interest again was on January 11th of this year, Dr. Daniela Lamas. She is a pulmonary critical care physician at the Brigham and Women's Hospital in Boston. And she's a contributing opinion writer. I follow her stuff. I read her stuff in the New York Times. She published an op-ed talking about the terrifying realization that someone might still be in there. I'm paraphrasing the actual column, and she was talking about her perspective as a critical care doctor when we see patients who are not responsive to verbal commands. And what we mean by that is we say, open your eyes, squeeze my hand, wiggle your toes, and they don't respond. Right? You see, and then they don't respond. This study suggested that perhaps some of them, and we'll go more in detail in the study, some of them actually can respond. They just can't do it observably, right? And we'll go over that. And so she talked about how terrifying that might be, and it is kind of terrifying. And I think it gives us actually more information and actually makes it better when we talk to families who have patients like this. So just to go over the study, it was published in, again, August 2024. What they did was let me look at this, look at here. It was a multinational study, okay, and they pulled out 478 participants out of a database, and they were excluded 125 of them. And so what they did is they had 353 patients that underwent the CRSR assessment, which is the Coma Recovery Scale Revised Assessment, right? And then they broke them down into 241 patients, 68% of them, who did not have observable response to commands. Again, squeeze my hands, wiggle your toes. And then they had 112 who did have observable response to commands. And so what they did was they did either functional MRI or EEG or both, right? And so some could do functional MRI, some could do only EEG, and then some had both, right? And so what they did was they then told them, imagine yourself playing tennis or doing something and then seeing, is there a response on functional MRI, or is there a response on EEG, or is there a response on both, right? And so what they found was, out of the 241 patients that did not have observable response to commands, 25% of them, 60, had a response to commands on imaging and were considered to have cognitive motor dissociation. And then conversely, 75% did not have response to commands on imaging. And so, what Dr. Lamas was saying is that it's terrifying that you think this patient's not responding, and maybe they are, right? And what I understood, and Dr. Lamas, if you're listening to this or you're watching this, I've already reached out. I'd love to get you on the podcast to kind of talk about this and kind of pick your brain. I think it would be very cool. So the door is always open on Healthcare Musings. Would love to have you. Anyway, so the fear is that there actually might be there, right? And are we withdrawing care too soon, right? Do we want to withdraw? Are we not giving them a chance to recover? And that's the fear, right? That you withdraw can't. And even in her column, she mentioned the tension that we always face, that I face, right? Is that do we withdraw care too soon? Do we stop trying, for lack of a better term, too soon, or are we just prolonging the inevitable by continuing aggressive artificial life support in somebody who is not going to have who the prognosis for meaningful recovery is going to be very, very small. The chance is going to be very, very small. A very poor prognosis. There's always that tension, especially in devastating lung injury, right? And so for me though, when I look at this study, I think it gives me more information. And so just to stop there, they found that, these patients had, some of them had brain trauma, cardiac arrest or hypoxia, stroke, brain hemorrhage. Those are the causes of the brain injury. For those, there was a lot only had a functional MRI or EEG. Some had both, and then when you look into the details of the supplementary material, there was very little agreement between the different tests, and that's an issue, right? I mean, I would think you should have a agreement between both, but there really wasn't, and so that's kind of an issue in this study. And then if you look at those. I remember that those with cognitive motor dissociation were younger, and that kind of makes sense, right? That the younger brain would have that situation. And at the same time, here's how I look at it, right? For me, when I see the results of the study, of course, I would not want to. No. First, before anything at all, we have to get to know, what does the patient want. I don't care if the patient is 25 or 95. It's so important that we have to ascertain the goals of care of that patient. Does the patient want to be maintained on machines? Okay, yes or no? We have to know that. If the answer is yes, okay, yes, done, finished. If the answer is no, we have to respect that as clinicians and as their doctors. This study, rather than making me scared that someone might be in there, quote unquote, in there, and when I can't tell, it actually gives me more information when I talk to families and say, listen, we've had recent research that shows that some people who are not responsive to commands may actually be responsive when you look at imaging studies. In the future, maybe if we can get functional MRI to be much easier, or have maybe sophisticated EEG where we can tell, maybe we can do that on a larger scale to tell, are they responsive or not? And still, if you have cognitive motor dissociation, where you're in there, but you can't express yourself, I don't know. To me, that would be torture. That would be absolute torture. That I can respond, but I can't express it. I can't move. I can't lift my hand. I can't eat. I can't do any of that stuff. But yes, I can hear and understand, but I can't respond. That to me, that's me. That's my goal of care. That would be torture. I think this research tells me that there could be a substantial number of patients. In this study, it was 25%. Maybe it's even more. Maybe it's less, but maybe it's even more, where they're actually they can hear and understand, but they can't express that. That to me is torture. Does your family member want to be like that? Is this something that would they want to live like that? And yes or no. If the answer is yes, okay, then we move forward and they continue with aggressive artificial life support. If the answer is no, then we have to continue to care for them, maybe with a focus on comfort. For me, this doesn't scare me. This research doesn't scare me. This research actually gives me more information. And to say, I don't know, for me, just so everyone knows I think everyone knows that I lost a child to cancer. This was in 2009. This is going to be almost 16 years ago, this year in June. If I knew that I didn't have to make the decision, thank God. I think, the Lord did it for me. At the same time, knowing that my daughter would be hooked up to machines and potentially hearing me and understanding, but not be able to express, that's torture. And I would never have put her through that kind of torture. Never. Period. I don't want to be that way either. Okay. My goal of care is I want to have quality of life. And if I can't have the quality of life, and if I have a condition with a very poor prognosis, I want to be, I want to die naturally. I don't want to have my life, my life prolonged by artificial means. And I want to go and I pray to the Lord that I get to meet my daughter again. I mean, that's my goal of care. This study gives me more information to help families understand that there may be where they're in there, but they can't express. How would they feel about that? What would they say about that? I think it aids goals of care discussion. The other thing that it does for me is that, so sometimes sometimes it's very sad to say, and it does happen. I think we have to acknowledge it. Sometimes caregivers will talk about a patient thinking that they don't understand because they're unresponsive, and this study shows that maybe they are responsive. Maybe they do understand what we're saying. And so I think this makes us be extra careful as a clinician to treat the patient with dignity. Yeah, maybe they're not, and Dr. Lamas actually mentioned that at the end, that she talks to patients like this, and I think it's going to encourage me to do the same thing. That when I walk into a patient's room who is unresponsive, quote unquote, air quotes, unresponsive, that I'm going to treat them with dignity and respect. I'm not going to denigrate them and talk, even though I would never want to do that. Still, so you have to keep. This is a constant reminder. When we walk into the room, we treat them with dignity. We tell them, "Hello, Mr. Smith or Mrs. Johnson. How are you? I'm just going to examine you right now. I'm looking at your things." To treat them with dignity and respect, even if they're quote unquote unresponsive. Now, in this study, 75% had no response on functional MRI or EEG, but that may be an undercount. So, I think this just further encourages us and reminds us that no matter what, the patient's unresponsive or responsive to commands, we need to treat them with the respect and the dignity that they deserve as human beings, and not talk about them or denigrate them, because they actually might understand, and that would be unimaginable suffering for me. So, I'm very grateful to Dr. Lamas for writing that column. It inspired this podcast episode. I'd love to have you on the podcast once again. And this study is an important one, and it teaches me two things. One, always treat the patient with dignity and respect, even if they're unresponsive. The other thing is, this gives us more information to help patients' families when faced with this horrific situation where not only they may never recover, and it looks like they're not going to recover, they actually may be responsive but unable to express themselves, something called cognitive motor dissociation. How would they feel about that? Would they want to live like that? And it just gives us more strength and more information to help guide families in these horrifically difficult situations. Thanks so much for your time and attention, guys. Until next time, Hashem Hasabala on Healthcare Musings. Thank you for watching. Sign up at healthcaremusings.com to get every episode delivered directly to your email. And please don't forget to leave a 5-star review. Thank you so much.